Good afternoon. I'm Wayne Ewasko. I'm the Advanced Education Skills and Immigration Minister with the Government of Manitoba, and today we are joined by Health and Seniors Care Minister Audrey Gordon and Chief Nursing Officer and Provincial Lead of Health Systems Integration, Lanette Siragusa. Thank you for inviting me to participate in this afternoon's incredible announcement in regards to student nurses for all Manitobans. I would first like to acknowledge that we here in Manitoba are on Treaties 1, 2, 3, 4, and 5 lands, which are the traditional territories of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and of course, the homeland of the Métis Nation. To begin, I would like to invite my friend and colleague, Minister Audrey Gordon, to share today's announcement. Minister Gordon?
Good afternoon, everyone, and thank you for joining me here today. Manitobans know and recognize the incredible contributions of nurses working in hospitals, personal care homes, and community and home care services across our entire province. And while this profession was valued and praised for demonstrating compassion and providing high-quality care long before COVID-19, the contributions of Manitoba nurses and all nurses have never been needed more than over the past 2 years. Our nurses have continued to provide care in the most difficult of circumstances. They've picked up extra shifts, seen a change to where and how they work, and have supported patients and their families, as well as each other, in ways that are nothing short of amazing. I know that you will all join me in saying thank you for their efforts. We know that the pandemic has put an enormous strain on nurses and that we must continue to add to this important workforce. That is why our government has committed to recruiting and retaining more nurses to work in our health system. It is why we're supporting internationally educated nurses to work in the field for which they have been trained. And it is why we've added 400 seats per year to nursing education programs to recognize that we must graduate more nurses in order to bridge the gap between the staff we have and the staff that we need. These are significant investments in expanding the pool of trained nurses well into the future. But we know there are also immediate needs, and that is why today we are announcing a new role that will support care within our hospitals, a role that is new to Manitoba, but which has been in place in a number of other provinces across Canada for many years. This role, undergraduate nurse employee, will provide third and fourth year nursing students with the opportunity to be paid to work and continue to learn in their chosen profession. These students will be able to make a competitive wage providing care in our hospitals under the mentorship and supervision of registered nurses while continuing to learn and develop their skills. I know that nursing students will be excited about this opportunity to have some enhanced hands-on clinical education working alongside their future nursing colleagues. And for more details on this role, I would like to pass things over to Chief Nursing Officer, Shared Health, Lanette Siragusa.
Okay. Thank you, Minister Gordon. So the undergraduate nurse employee program is an opportunity that is available to third and fourth year undergraduate nursing students. It's paid work experience while they are completing their studies. Under the supervision of regulated nursing professionals, these students will work as casual staff on inpatient units across the province in surgery, medicine, and mental health. In order to be eligible, nursing students must have completed 450 clinical practice hours, as well as completed a clinical placement in surgery, medicine, or mental health. In discussions with our colleagues in Alberta, there are many benefits that come with this program. The undergraduate nurse employees, we'll call them unis, will have the opportunity to build upon the skills that they learn in school and gain confidence through their hospital experience. This will allow them to build an understanding about how to function within the profession and among the clinical teams, and also gives them an early advantage when they graduate and start looking for a position in the health system. The unis will be gaining seniority from day one when they start, and this seniority counts hours towards their overall contributions within the health system, so that when they graduate, they can be competitive in seeking positions. There are many reasons why people choose to become a nurse. One common reason that we hear is that they want to help people in their times of need. Another reason is to be in the presence of highly skilled professionals and work as part of a team who make an impact in the world every single day. So this is a very unique and inspiring time to watch and learn and practice under the supervision of these healthcare experts. It has been a long time since I was a student nurse, but I do still vividly remember what it's like to walk into a hospital and experience the energy and the sights and the smells and the sounds, and it's unlike anything that you've really experienced before. And the more that you work and practice and have those experiences, the more skilled you become. And the more you have interactions and receive feedback, the more confidence that you gain. So perhaps most importantly, this program for nursing students puts our novice nurses into the healthcare facilities, where they'll gain familiarity of the processes. They will build competencies in the clinical environment, and they will develop relationships with mentors and teammates. They will find out firsthand about the positions that will be available to them when they graduate. The mentorship that these students will receive, combined with the responsibilities that they will have in their role, will help them to be that much more prepared when they graduate and enter the workforce as registered nurses and as registered psychiatric nurses. These positions will be casual days, evenings, and weekends, no nights, and there will be the ability to flex up to full-time hours when school slows down and they have more availability, so potentially in the summer or during winter holidays. As nursing students, we learn in the classroom, we learn in the skills lab, we learn when we do our clinical placements and our practicums, but nothing really replaces the experience of contributing as a team on the units with patients. So while this is we think it'll be a great experience for the students, I do also want to say how much we in the system are looking forward to welcoming these students. They are novices in the hospital, but they also come with fresh perspective and new ideas, and we think they're going to be a valuable asset both to the teams that they're working with and also to the patients that they will serve. Thank you very much.
Thank you, Minister Gordon, and thank you, Lanette, for the overview. Today's announcement showcases our government's continued commitment in providing Manitoba students opportunities right here in Manitoba. The skills, talent, and knowledge strategy, which provides guidance to post-secondary institutions, employers, and our government to ensure Manitoba has the people with the right skills at the right time to support economic growth both now and into the future. By providing nursing students valuable paid experience in Manitoba, care teams, we are showing them that there are opportunities for valuable employment right here in Manitoba and better preparing them to enter the workforce later on in their careers. I'd like to thank all of you for joining us here today. I'd like to again thank Minister Gordon and Lanette for the great announcement and the overview. And at this time, we're going to open up the opportunity for any questions.
Sure. So the question was, what's the difference between a practicum and this program? So a practicum there's different practicums throughout a nursing student's four-year education, and they go to different units. So they might go to medicine, they might go to surgery, they might go to mental health. They often will go to community and acute care settings, and they're for defined periods of time, often 6 weeks. If they're doing a senior practicum, it might be for 12 weeks, and so they build expertise and competencies that way. This is that's all for free, and that's part of their education. So this program is a paid experience, so they will be paid. They will be assigned their own patient load depending on their experience and their responsibilities, and they have the opportunity to flex up, and they will be supervised. So they will not be regulated nurses, but they will be unionized employees, and they will have the benefits of that, and just great experience being part of the team. And on a more permanent basis, potentially, so it won't be just a 6-week or 12-week experience. It could be longer term than that, given that it's third and fourth year nursing students who can be eligible.
Do you know how many nursing students will be able to, that are ready to partake in this program, or have you heard from them, roughly how many will take part?
Yeah, so we are starting with just over 60 students across the province to be placed on medicine, surgery, and mental health units. But when we actually look at the potential of how many nursing students could be eligible in third and fourth year, it will be closer to 500 nurses. But we want to start slow. We want to make sure we evaluate as we go. We make sure that the supervisors are having a good experience as well as the students so that it's successful.
When do you expect potentially, if everything goes well, to be able to flex up to that 500 student nurses?
Yeah, we're going to see how it goes, but we are hoping before the end of the year we'll be introducing these students into the clinical placements, and then we'll evaluate regularly and gradually build up over time. Yeah, we have been in conversations with our colleagues in Alberta. They have had something similar like this for about over 20 years, and so they were very generous with sharing their learnings. It will be important for these students to go to units where there's stable staffing and there's stable patients to start them off with, because we do want to build that success. But there's potential to build even more opportunities as we go. Once we make sure we have a really good program and people are feeling confident and going in and doing really great work.
How much has the pandemic staffing issues become an incentive for this program? Was that in mind for you?
Did you want to answer this? Yeah?
Well, as you know, I'm the Minister of No Box Thinking, and so I'm always looking to my teams and to the leadership across the region and shared health to bring forward creative and new ideas, and some of it will come right here from the grassroots in Manitoba. Others will be borrowed from other jurisdictions in terms of their best practices, and we will adapt them to the Manitoba environment. So certainly we're looking to a lot of innovation and creativity, not just across our province, but across the country and possibly international. I had a really good discussion today with the High Commissioner for Jamaica stationed in Ottawa, and we were having a conversation about some things even Jamaica is doing, you know, and so there's lots of opportunities, and our staffing needs are not unique just to our province. These issues are being felt right across the country, where we need to staff up in our nursing complement, and so I think this is great. This is a really good start for us, and I hope to see a lot more innovation in the months and years to come.
What are the dollars behind this program to be able to cover costs of bringing on the student doctors?
Do you want
For student nurses?
I don't have the total budget right now that was approved, but I can tell you that the nurses will be receiving $27 an hour as the unis, the undergraduate nurse employees.
When you talk about casual shifts or on-call casual, when they go in, will they work like a 3-hour shift, or will it be like that full 8-hour shift, kind of like a substitute?
Well, typically it would be a full shift, a 7 3/4 is what we call, or a 12-hour shift, depending on the unit and what they've applied for. And ideally it would be scheduled in advance so they know and they can work around their school schedule and their lives. And then, as I said, there is the opportunity for them to pick up, and they can pick up at any time. They might be called and offered more shifts, but they'll let us know their availability, and we will work with them on that.
Especially at first, how much oversight is there going to be from the nurses currently on staff and what they're working with, or are they going to have a freedom that student nurses themselves are going to be constantly monitored? And has that been considered an increase in the workload for the nurses currently on staff?
Yeah, that's a really good question. So we want the nurses, the regulated nurses who are working on the unit, they do oversee other staff like healthcare assistants on the unit, so they delegate some of the functions. This would be similar to that, where these nursing students are employees, and they will have certain responsibilities that match their competencies. So a third-year student might have a different ability than a fourth-year student, and so the nurses would assign these students based on what they know, what they're capable of, and set them up for success. And so hopefully we're hoping that it will be helpful to the nurses and also helpful to the students, so a two-way win.
Ms. Siragusa, you just mentioned that Alberta's had this for 20 years and some other provinces had it. That begs the question, why does Manitoba have this?
Why does Manitoba have?
Well, if Alberta has had this, or forgive me, projecting here is terrible. Manitoba's had this, Alberta's had this for 20 years, and other provinces have had it as well. Why did Manitoba not bring this in earlier?
I can't answer that, but when we heard about it, we thought it was a great idea, and we initiated it. We worked with the union. They were reciprocal to having it. They were receptive. And so I can't speak to what happened in the past. I can just speak to where we're going now. Yeah, so when we talk to the colleges of nursing, they give us the update in terms of how many nurses are regulated and how many are renewing their license. It doesn't look that different from the college's perspective, from what I understand. But what I think we're feeling is that staff are tired of COVID and they're exhausted, and some have, they're needing a break and they're needing a change. So people are looking at different positions, maybe in different units and sometimes different codes. So that instead of full-time, they might be looking for part-time. So we're aware of that. And again, as Minister Gordon said, that's happening all over, not just in healthcare, that's happening in all areas. So we're watching that. When we look at vacancies, it's a little bit hard to gauge because we've added a lot of positions into the system because of COVID. We've added positions into public health that never existed before. Immunizers, isolation units, contact tracers. So we never had those before. We've added those, and we've also added a lot of positions into ICU. So they haven't all been posted and filled, so they're vacant, but they're in addition. So I think normally we sit around overall provincially around 10%, but it's a moving target, and some areas are more chronic and have higher vacancies than that. Others are lower than that. We are sitting higher than that right now, but it could be because of those extra positions as well. So we're continuing to watch. We're continuing to look at the priority areas in a pandemic, which is different than in a normal state when we're staffing, and really trying to look at both recruitment and retention. And how do we make sure that our nurses, not just our nurses, all our staff are getting time to rest, they are contributing to opportunities where we can do better for them and for the patients. We're continually looking at, are there any safety issues, which we haven't seen. We've been looking and evaluating. So all this continues on as we go through the pandemic and work through this fourth wave.